Hi, and welcome back. In this section, we are going to learn how urine is formed. And there are three basic steps for this. The first step is known as glomerular filtration, where substances that are in the blood will then leave the blood vessels and enter Bowman's space. So this includes fluid as well as solutes. This will be followed by our second step known as tubular reabsorption, where you can see that substances that are either in the tubule, and that stuff that we're now going to call the filtrate, has a chance to exit the tubule, go into the epithelial cells of the tubule, from which they then enter the peritubular fluid, and from there they can diffuse back into the bloodstream. And in the third step, known as tubular secretion, this is the final chance where substances that are in the blood or the peritubular fluid can then go into the tubular cells to enter as part of the filtrate. So we're going to take these one by one, and in this video, we're only going to be looking at glomerular filtration, step one. So there is a lot of glomerular filtration that happens each and every day. About 180 liters of your blood are filtered. Now, you know you only have 5.5 liters of blood total, so that means most of it has to get returned, and it's repeatedly filtered throughout the 24-hour period. And whatever is filtered is then going to be called a filtrate from the point that it enters Bowman's space. Now, at times of really high cardiac output, we can filter your entire blood volume in as little as 20 minutes. Now, normally it does take longer because your cardiac output isn't nearly as high. And so filtration has to occur where you see these purple arrows across what is called a couple of structures forming a filtration membrane. So what we have on one side is we have a blood vessel, the glomerulus, which has an endothelium, which in this case is fenestrated. It has these spaces in it. And underneath that, we have a specialized but complete basement membrane. And so what will become the filter has to go through these fenestrations and across the basement membrane, where then it is met with the filtration slits, which are actually tiny little spaces between those pedicels, those foot processes of the podocytes that completely surround the glomerulus. So that's what the filtration membrane actually is when you're hearing about it. So what determines how much is filtered has to do with our net filtration pressure. Now, we've talked about filtration pressure several times this semester, so this is no difference. Filtration is going to be governed by a combination of hydrostatic pressures in the blood vessels pushing stuff out, as well as osmotic pressures pulling things back into the blood vessels. And in the kidney, there's a net outward pressure of about 10 millimeters of mercury. The number is not important. What's important is to realize it's fairly low. However, things are going to exit, but only a few distinct proteins that are small, such as albumin, can cross. If too much protein crossed, then there wouldn't be as much of a blood colloid osmotic pressure pulling things back into the blood vessels. So no large proteins or cells can cross unless that glomerulus is damaged. Hopefully you saw on the previous slides, you could see the size of a blood vessel compared to the size of the fenestrations in the blood vessel. Sorry, see the size of a blood cell in comparison to the size of the fenestrations in the glomerulus. Now, there are cells we haven't talked about yet, known as mesangial cells. And mesangial cells are supporting cells found within the renal corpuscle, but they're between and actually physically attached to the glomerular capillaries. So in this picture, you can see the outer Bowman's capsule, and then the blue cells are the podocytes with the pedicels. The red, as you would expect, are the capillaries, the glomerulus with their epithelial cells. And all of these yellow cells here in the middle, where you can see attached to the capillaries as well as attached to the afferent and efferent arteriole of the glomerulus, those yellow cells are the mesangial cells. Now here's a different picture so you can see it from a cross section looking at it on an electron microscope type of view, where you can see the glomerulus with its large red blood cells that can't possibly be crossing unless there was damage to the glomerulus. You can see the fenestrations. Then you can see the foot processes of the podocytes and all the little filtration slits. And then this cell right here in the middle, which you see is clearly attached to 3 cross sections of the capillary bed in this picture. These are the mesangial cells. And the mesangial cells can contract in size, in which case they would be pulling on the capillaries, enlarging their diameter, or they can relax and become bigger, in which case the capillary diameter would be decreasing. And so by the action of these mesangial cells, these can directly affect the glomerular capillary blood flow and thereby decrease the amount of filtrate being produced. Now we have a name for this filtrate being produced, and this is called the glomerular filtration rate. So what is this? Well, it's the amount of filtrate that is formed per minute by both kidneys combined. And in a normal adult, it's normally around 100 or 125 millimeters per minute. So we think that normally anything above 90 to 100 would be normal renal function, or else not significantly impaired renal function. And this glomerular filtration rate, or GFR, will be constant as long as we have a mean arterial pressure that is somewhere between 80 and 180. So as you can see, there's a wide variety of blood pressures, which will still give us a normal glomerular filtration rate. So high blood pressure, just the fact that the blood pressures are high, doesn't decrease the mean arterial pressure. But if high blood pressure causes disease in the kidney, as it will when it's not being treated, then that would cause a decrease in the glomerular filtration rate, as seen in patients with hypertension. So this filtration rate then is governed by the total surface area available for filtration, as well as the permeability of the membrane and those net filtration pressures. All those things we've talked about previously. But we can change the filtration rate. We have an intrinsic method where those juxtaglomerular cells themselves are looking at blood pressures and blood volumes. And so they can control, through renal autoregulation, they can control the blood flow into the glomerulus, thereby affecting glomerular filtration rate. And in addition, we have extrinsic methods, both the nervous system, sympathetic nervous system, as well as endocrine mechanisms, where we can maintain blood pressure, but actually directly affect renal function. So with that, we are done with the first step, and I will see you shortly as we move on to step 2 in urine formation. Thank you for all your concentration and hard work in this class. We really appreciate it.